Good evening, everyone. My name is Halmeia Lim, and together with me is Michellene Porras, Anneka Estrada, and Glordelen Tungia. We are going to tackle macrominerals, specifically calcium, phosphorus, and magnesium, in relation to how they affect our oral health and our entire body. So let us start with defining macrominerals. When we say macrominerals, also known as major minerals, these are the essential mineral nutrients in the human body that are required in relatively large amounts as they are used in important body and cell building or processes. According to Understanding Normal and Clinical Nutrition by Rolfs et al., we need greater than 100 milligrams of macrominerals per day. So some of these macrominerals are the calcium, phosphorus, magnesium, sodium, potassium, chloride, and sulfur. Macrominerals do so much to our body and have a wide range of functions. One of its main functions is the bone and teeth building. This is due to the abundance of calcium in our body. Also, it is maintaining the bodily fluid balance by aiding the electrolytes in the right concentrations. These are also necessary for energy metabolism, nerve transmission, enzyme action, immune system boosting, and maintaining cell structure and function. Let's first discuss calcium. It is the most abundant mineral in our body. 99% of the body's calcium is mainly found in our bones and teeth, while the remaining 1% is in the body fluids. So what are the sources of calcium? Those are milk and milk products such as yogurt and cheese. If you are lactose intolerant, you can opt to get calcium from tofu and oranges. So one of the two main functions of calcium is to provide a rigid frame of bone structures that holds the body and serves as an attachment point for muscles. These bones act as our calcium reserve as well. As bones begin to form, calcium salts form crystals called hydroxyapatite. This is the mineral that forms teeth and parts of the bones, which during mineralization, they give strength and rigidity to the maturing bones. So, as a result, the long leg bones of children can support their way by the time they have learned to walk. Next, another main function of calcium is to strengthen the enamel, for calcium is one of the most important nutrients for a healthy teeth. And the daily recommended amount of calcium to protect the enamel is 1 to 2 grams. Aside from forming healthy skeletons and teeth, adequate intake of calcium helps in minimizing bone loss in later life. It also helps in maintaining normal blood pressure, helps muscles relax and contract, blood clotting, blood pressure regulation, and boosts the immune system. Now, let's further discuss the significance of the macrominerals in dentistry and nutrition. So, as what I've said earlier, calcium is the most common and one of the most important minerals in the body, for it plays different roles in our oral health and our entire body. In our oral health, it plays a vital role for proper development and maintenance of dental bone structures. It also strengthens the hard outer shell of our tooth, which is the enamel. This is our tooth's defense against erosion and cavities. It improves our oral health by helping fortifying teeth against oral bacteria. And lastly, it acts as a remineralization agent, which means that the calcium helps repair the damage caused by a certain bacteria. Next, let's tackle how calcium works as a nutrient in our body. First, it builds strong bones. Calcium is the major component of the bones. It keeps our bones dense and strong. Low bone density may cause our bones to become brittle and fragile for injuries. Next, calcium helps nerves work. Calcium is present in our nervous system, thus it initiates and regulates responses in our central nervous system. Furthermore, muscle contraction. Calcium ions and proteins bind to actin also plays a crucial role in both muscle cell contractions and relaxation. To elaborate, calcium then binds to troponin, causing the troponin to change shape and remove the tropomyosin from the binding site. Calcium also plays a vital role in blood clotting. Without calcium, blood will not clot. It also lowers blood pressure in young people, improves cholesterol values, lowers the risk of colorectal adenomas, which is a type of a non-cancerous tumor. Lastly, it maintains healthy communication between the brain and other parts of the body. It is important to ensure proper calcium intake at all ages to prevent from acquiring diseases. According to the National Institutes of Health, the recommended daily allowances for children and teenagers for calcium are the same for both sexes. Children from birth to 6 months need 200 milligrams. Children ages from 7 to 12 months need 260 milligrams. 1 to 3 years old need 700 milligrams. 4 to 8 years old need 1000 milligrams. And lastly, 9 to 18 years old need 1,300 milligrams. Let's discuss the calcium requirements for adults both in men and in women. Let's start off with women who ages from 19 to 50 years old. They need 1,000 milligrams per day, and women who ages 51 years old and above, along with pregnant and lactating women, need 1,200 milligrams per day. On the other hand, men who ages 19 to 70 years old need 1,000 milligrams per day, and those who are 71 and above need 1,200 milligrams per day.
This time, let me discuss to all of you the conditions caused by calcium deficiency. Hypocalcemia is the condition used to describe calcium deficiency. It is a condition in which there are lower than the average levels of calcium in the liquid part of the blood or the plasma. Some people don't have any symptoms or signs of hypocalcemia, but most likely, people may experience 1. Muscle stiffness, 2. Muscle spasms, 3. Paresthesia, the feeling of pins and needles or stinging sensation, 4. Changes in mood, anxiety, irritability, depression, 5. Also, memory issues, 6. Difficulty in speaking or swallowing, 7. Fatigue, and 8. Swelling of the optic disc. The symptoms of severe hypocalcemia are 1. Seizures, 2. Arrhythmias, a condition in which the heart beats with an irregular or abnormal rhythm, 3. Congestive heart failure, 4. Laryngospasms or seizure of the voice box. The long-term symptoms of hypocalcemia include 1. Dry skin, 2. Brittle nails, 3. Dementia, 4. Cataracts, 5. Eczema, and 6. Kidney stones or other calcium deposits in the body. Osteopenia is a condition that begins as you lose bone mass and your bones gets weaker. This happens when the inner portion of your bones become brittle from a loss of calcium. People who have this condition are at a higher risk of having osteoporosis, which I am going to discuss later on. So, you can always avoid osteopenia. No matter what you do, bone mass decreases over time. However, there are some things that you can do to lower your risk. Most importantly, you have to get enough calcium and vitamin D through foods or supplements. Must also maintain a healthy diet. Eating disorders such as bulimia and anorexia nervosa can decrease your bone mass. Get regular exercise. Stop smoking if you smoke or using tobacco, and avoid or limit alcohol use and drinking of carbonated beverages.
Another condition caused by the lack of calcium is osteoporosis. Since low calcium intake contributes to the diminished bone density, Early bone loss and an increased risk of fractures may cause osteoporosis. It is a bone disease that occurs when the body loses too much bone, makes too little bones, or both. As a result, bones may become weak and break from fall, injuries, or other serious cases and accidents. There are typically no symptoms in the early stage of bone loss. But once your bones have been weakened by osteoporosis, you might have signs and symptoms that includes back pain caused by a fractured or collapsed vertebra, loss of height over time, a stoop posture, and a bone that breaks much more easily than expected. These are some of the risk factors for osteoporosis. First one is sex or gender. Women are much more likely to develop osteoporosis than men because hormone changes that happens at menopause directly affect the bone density. The female estrogen hormone is essential for healthy bones. Thus, after menopausal, estrogen level falls and this can lead to a rapid decrease in bone density. Second one is age, because the older we get, the greater risk for osteoporosis. Next is family history, simply due to genetic inheritance. Lastly, body frame size. Men and women who have small body frames tend to have higher risk because they might have less bone mass to draw from as they age.
Now, let's tackle the effect of lack of calcium intake in oral health. Again, one of the most important nutrients for a healthy teeth is calcium. Calcium strengthens the hard outer shell of our tooth, which is enamel, our teeth's defense against erosion and cavities. If a lack of calcium is observed, your body will start to take calcium from your bones and teeth instead. It will not only weaken your bone but also your teeth, placing you on an elevated risk for damage, tooth decay, periodontal or gum diseases, increase in cavities formation, jawbone to weaken, and it is more likely your teeth will loosen and possibly falls out. As usual, prevention is the best way to treat calcium deficiency teeth. Do so by scheduling regular oral prophylaxis or teeth cleanings, using enamel strengthening toothpaste, monitoring your calcium serving intake, and indulging in foods high in calcium. Too much of good is not good at all. So right now, let me discuss the effects of excessive intake of calcium. Hypercalcemia. This is a condition in which the calcium level in your blood is above normal. Too much of calcium in your blood can weaken your bones, increase in kidney stone formation, and interfere with how your heart and brain work. Usually, it is a result of overactive parotid glands. Other causes of hypercalcemia include cancer, kidney stones, other medical disorders, and taking too much of calcium and vitamin D supplements. If your hypercalcemia is mild, you might not have signs or symptoms. Severe cases usually produce signs and symptoms related to the parts of your body affected by the high calcium levels in your blood. And these are the following. First, kidney. Excess calcium makes our kidney work harder to filter it. It can cause excessive thirst and frequent urination. Followed by digestive system. Hypercalcemia can cause stomach upset, nausea, and constipation. Next, bone and muscle. In most cases, the excess calcium in your blood was leached from your bones, which also weakens them. This can cause bone pain and muscle weakness. Next is brain. Hypercalcemia can interfere with how our brain works, resulting in confusion, lethargy, and fatigue. It can also cause depression. Last, heart. It happens rarely, but severe hypercalcemia can interfere with your heart function, causing palpitation and fainting. Indication of cardiac arrhythmia and other heart problems. So there are three classifications of hypercalcemia, and these can be classified into the level of corrected total serum value of hypercalcemia. First, mild hypercalcemia. Corrected calcium level is greater than 10.5 mg per deciliter to less than 12 mg per deciliter. Followed by moderate hypercalcemia.
Corrected calcium level is 12 to 14 mg per deciliter. And the last one is the severe hypercalcemia. Corrected calcium level is greater than 14 mg per deciliter. So excessive calcium intake oral manifestations are soft tissue calcification, tooth sensitivity when biting or chewing, malocclusion, cavities, and jaw pain.
Let's proceed to phosphorus, the second most abundant mineral in our body. Foods rich in proteins such as meat, poultry, fish, milk, and cheese are the best sources for phosphorus. And because phosphorus is commonly found in almost all foods, dietary deficiencies are unlikely. Excessive intake can disrupt normal bodily functions, which will be discussed later on. But high intakes of phosphorus are not common when diets are based mostly on fresh foods. Phosphorus has a lot of importance in our body. Together with calcium, it aids in forming bones and teeth as 85% of it is found in hydroxyapatite crystals. Also, it is in all body cells as a part of a major buffer system for it maintains acid-base balance. Additional function, it also assists in energy metabolism because high energy compound ATP uses 3-phosphate group to do its work. For example, the B vitamins becomes active only when a phosphate group is attached.
The amount of phosphorus you need depends on your age and situation. From birth to 6 months, they need 100 milligrams of phosphorus. For infants, they need 275 milligrams. For children from 1 to 3 years old need 460 milligrams of phosphorus. Children from 4 to 8 years old need 500 milligrams, while children from 9 to 13 years old need 1,215 milligrams. The teens that ages 14 to 18 years old need 1,250 milligrams, as well as the pregnant and breastfeeding teens. While the adults from 19 years old and above, they only need 700 milligrams of phosphorus. Lastly, those who are pregnant and breastfeeding women, they need 700 milligrams of phosphorus per day.
As what we have tackled, calcium often gets the spotlight for protecting the bone health. Phosphorus is just as important. Truth to be told, phosphorus deficiency is uncommon. It only happens when the body has low levels of its vital mineral. You may experience a number of bone-related symptoms if you have phosphorus deficiency. For example, you may have bone pain or fragile bones that breaks more easily. Other symptoms include anxiety, fatigue, irregular breathing, irritability, joint stiffness, numbness and weakness, and changes in body weight. In addition, children who don't have enough phosphorus in their bodies may experience delay or poor growth patterns and issues with bone and tooth development. Hypophosphatemia is a condition that lacks phosphorus in the body. The common causes of this disease are the following. First one is starvation. Based on study, severe starvation cases can result in hypophosphatemia. Next, anorexia, referred to as an eating disorder. Lack or loss of appetite for food. Individuals who possess this condition will most likely to have hypophosphatemia. Third one is diabetes. Diabetes can also lead to a deficiency, especially for people recovering from an episode of diabetic ketoacidosis. This means that the body isn't producing enough insulin and can break down fat as fuels. Thus, acid builds up in the blood which can cause a phosphorus deficiency. Fourth one is alcoholism. Alcoholism may lead to a malnutrition as well. As a result, people who are hospitalized due to alcohol abuse might develop nutritional deficiencies including hypophosphatemia. Last and final cause is inherited disorder. There are certain genetic disorders that affects the body's ability to store phosphorus. Also, Some disorders are often the result of excreting too much phosphorus in the urine or not absorbing the mineral from foods.
Once again, hypophosphatemia is when there is low level of phosphate in your blood. Symptoms may include weakness, trouble breathing, and loss of appetite. Complications may also include seizures, coma, and in our oral health, this is what we call rhabdomyolysis or softening of the bones and teeth. Teeth become more brittle than normal and chip easily.
Next, we have osteomalacia. This condition can be seen in both children and adults. It refers to the softening of the bones related to vitamin D deficiency. You may not be able to experience symptoms in the early stage. However, as it progresses, you may experience a dull aching pain, particularly in the lower back, pelvis, hips, legs, and/or ribs.
Let's discuss how excessive phosphorus affects our body. High phosphorus levels can cause damages to our body. Extra phosphorus causes body changes that pulls calcium out of our bones, making them weak. High phosphorus and calcium levels also lead to dangerous calcium deposits in the blood vessels, lungs, eyes, and heart. Too much phosphorus can result to hyperphosphatemia. When we say hyperphosphatemia, having a high level of phosphate or phosphorus in the body causes bones and muscle problems and increase your risk for heart attacks and strokes. Most people with high phosphate levels don't have symptoms. However, in some people with chronic kidney disease, high phosphate levels causes calcium levels in the blood to drop. The following symptoms of low calcium includes muscle cramps, numbness and tingling around the mouth, bone and joint pain, weak bones, and lastly, rash and itchy skin. Excessive phosphorus intake can be toxic, which causes diarrhea and hardening of organs. This can also affect other important minerals the body uses, especially calcium. It pulls calcium from the bones and teeth, which causes them to become brittle, unhealthy, and at higher risk of breakage.
Last to be discussed is the magnesium. Magnesium can be found in nuts, dark chocolate, banana, and seeds. It is part of the chlorophyll molecule, so dark green leafy vegetables are also a good source. An adult body contains approximately 25 grams magnesium. More than half of the body's magnesium is in the bones. Much of the rest is in the muscles and soft tissues, with only 1% in the extracellular fluid. Magnesium is critical to brain and heart function. It also seems to protect against hypertension and heart disease.
Magnesium is important because magnesium and calcium work together and complement each other in their efforts to build hard tooth enamel and maintains bone density. Just like the other two macrominerals, it strengthens structural support, which means it strengthens your jawbone. Now, let me discuss how magnesium affect and work in our body as a nutrient. It is essential for energy production and metabolism. It acts as a catalyst in the reaction that adds the last phosphate to the high energy compound ATP, which is essential to the body's use of the glucose, the synthesis of protein, fat and nucleic acid, and the cell's membrane support system. Together with calcium, magnesium is involved in muscle contraction and blood clotting. Calcium promotes processes, magnesium inhibits them. Moreover, magnesium helps regulate blood pressure and lung functions. It helps prevent blood vessels from constricting, which can increase blood pressure and it improves blood flow. Magnesium sulfate is a bronchodilator, which means it relaxes the bronchial muscle and expands the airways, allowing more air to flow in and out of the lungs. Furthermore, it supports normal functioning of the immune system. Magnesium keeps our immune system strong against diseases.
What is the RDA for magnesium in adults? The daily recommended dietary allowance for magnesium. For 19 to 30 years old men, 400 milligrams and 310 milligrams for women. Those who are ages from 31 years old and above men, 420 milligrams and 320 milligrams for women. For pregnant women ages 14 to 18 years old, they need 400 milligrams. For pregnant women ages from 19 to 30 years old need 350 milligrams. And for 31 to 50 years old pregnant women, they need 360 milligrams.
Hypomagnesemia is a condition in which there are low levels of magnesium in the body. Low magnesium is typically due to decreased absorption of magnesium in the gut or increased excretion of magnesium in the urine. This is because magnesium levels are largely controlled by the kidneys. The kidneys increase or decrease excretion or the waste of magnesium based on what the body needs. Continually low dietary intake of magnesium, excessive loss of magnesium, or the presence of other chronic conditions can lead to hypomagnesemia. So, there are conditions that increase the risk of magnesium deficiency, including gastrointestinal diseases, advanced age, type 2 diabetes, use of loop diuretics such as Lasix, treatment with certain chemotherapies, and alcohol dependence. Let's discuss it one by one. First, we have GI diseases such as celiac disease, Crohn's disease, and chronic diarrhea. This can impair absorption of magnesium and will result in increased magnesium loss. In type 2 diabetes, the higher concentrations of blood glucose can cause the kidneys to excrete more urine, but it will also cause the increase of loss of magnesium. Alcohol dependence can lead to poor dietary intake of magnesium, increased in urine and fatty stools, liver diseases, vomiting, kidney impairment, and all of these conditions that I have mentioned have the potential to result in hypomagnesemia. In older adults, gut absorption of magnesium tends to decrease with age. Older adults often eat fewer magnesium-rich foods, and they are also more likely to take medication that can affect magnesium, such as diuretics, and these factors can lead to hypomagnesemia in older adults. Last, we have the use of loop diuretics. When we say diuretics, it is also known as the water pills. These are medications designed to increase the amount of water and salt expelled from the body as a urine and can sometimes lead to loss of electrolytes such as potassium, calcium, and magnesium.
If hypomagnesemia and its underlying cause remain untreated, severely low magnesium levels can be developed. Severe hypomagnesemia can have life-threatening complications such as seizures, cardiac arrhythmias or abnormal heart patterns, coronary artery vasospasms, a sudden tightening of muscle within the arteries of your heart, and worst of all, sudden death. In addition, magnesium deficiency can be also associated with hypokalemia disease, a deficiency of potassium in the bloodstream, cardiac, and neurological manifestation. Again, magnesium is an essential mineral for overall health, and it also plays a critical role in building strong teeth and bones. Magnesium helps the body absorb calcium, which is vital to building strong teeth and tooth enamel. Our teeth and bones hold 50 to 60% of magnesium. Inadequate intake of magnesium will lead to a significant amount of bone loss. If we are not getting sufficient amount of magnesium from our diet, it doesn't matter how much calcium we consume, for our teeth are only able to form hard enamel if adequate amount of magnesium is available. Last to be discussed is the effect of excessive intake of magnesium in the body. A magnesium overdose can lead to hypermagnesemia. This is a condition when there's too much magnesium in your blood. Although it's rare, it can occur in people with chronic health conditions such as chronic kidney disease. So magnesium overdose may result from taking too much of a supplement or any medication containing magnesium. According to the Office of Dietary Supplements, the symptoms of magnesium overdose may include diarrhea, nausea and vomiting, lethargy, this is where you feel sleepy or fatigued, muscle weakness, abnormal electrical conduction in the heart, low blood pressure, urine retention, respiratory distress, and the last is cardiac arrest. Magnesium overdose can make you feel nauseous and vomit a lot. This vomiting promotes erosion on teeth by the acid that flows over the enamel as it exits the mouth. The tooth outer covering can be lost and the teeth can change in color, shape, and length, becoming brittle, translucent, and weak.
So that's the end of our discussion. If you have questions, clarifications, and other suggestions to the topic we have discussed, please don't hesitate to tell us. Thanks for watching and have a great day!